there is a time when you should become pregnant. The ideal age for woman should be 20 to 24 and man should be from 22 to 26, 28. When it is M for teaching your child, M for monkey, you are doing your MBA. So how will you have a child?
When we talk about fertility and going to the clinic, is it only a woman's thing or two people going together or individually, irrespective of the gender, and getting it checked?
40% could be in a male, 40% in female, and 20% could be somewhere which we gray area we don't know.
Now, what you realize is one of them is not either the semen or the egg isn't of the quality that you'd want for it to have healthy children or a child. Is there a alternative where one can actually get a donor, or are there options like that? Biology versus career. If you can just touch upon the fertility issues, what does it really mean? Because fertility and having children, a lot of people look at fertility issues only when they want to have a child, right? So what does it really mean? What does it mean?
So typically, one should understand that there is a time when you should become pregnant for every species. So if it's a dog, say it is 3 year or 4 years, or if it's a fish, there may be 6 days and 7 days or 1 month. So for humans, the ideal age for woman should be 20 to 24 and man should be from 22 to 26, 28. Okay. Now, don't look bit surprised at me. So the thing is, what recent data is suggesting that after the age of 32, for Indian women, the egg reserve, that is the ovaries producing eggs, are falling down. Now, when you look at the chat GPT, it will show you Caucasian data, which says after 35. So they feel we have good reserve. Now, typically what happens, they want to finish their career, the degree, that is super specialization, then experience, then marriage, then get established in the marriage, and then have financial freedom, travel around the world, and then they start thinking about having a child. By the time they don't even realize they have crossed 34, 35. Now at 34, 35, all these youngsters or all population, like every other population, has become very they want at the snap of the shot, and if it doesn't happen, they get stressed and they go to electronic media and start finding out information. Even first cycle, they will plan it, your ovulation day and everything. They will not just try like that. Okay. So these are the things, and that if it doesn't happen, they start getting stressed. And this is typically happening in these cycles. So my suggestion is, when it is M for teaching your child, M for monkey, you are doing your MBA. So how will you have a child at a reasonable age? Imagine you are at 35. When your child becomes 6 year old, you are already 42, your husband is 46. Will you be able to run with the child in the garden? Will you be able to give him that much time with your condition to look after and your parents to look after? Is it reasonable? That is what sometime I feel, that I think they should actually look back, learn it from everyone, and go back and try and get married a little earlier. Don't time it. If you want to postpone it, go to the doctor, look at your fertility, do some fertility tests, and then decide whether to postpone it or not to postpone it.
How my body works versus someone else's will definitely differ. My parents got married very early, in their early 20s, right? And it wasn't because they were great planners. It was because the society asked them to, right? If you look at now, today, parents are talking about, okay, you know what, get educated, have financial freedom, buy yourself a house, find yourself a good man or a woman, and then get married, right? The conversation around when one wants to plan has completely changed because of how parents have taught. They've taught now individual children to be much more independent than it was. Now, you mentioned something about starting to think about going to the doctor in the very first place, right? What's an ideal age to go to a doctor and, get yourself tested?
I think anyone who is delaying their childbearing after 30, I think they should see a doctor beforehand. And it's a woman empowerment has changed the whole scenario. Now, the woman doesn't want to become pregnant too early and get caught up into the regular so called routine to look after the child and the house chaos and leave the job and go behind the children. So they want to have little more freedom for themselves and have a career for themselves. And that is what also should be looking into. And I'm not saying that the boys cannot. Nowadays, some of the boys also do work from home and look after the children, but that understanding has to be there.
So, when we talk about fertility and going to the clinic, is it only a woman's thing, or are there enough procedures and knowledge for both couples to go together, two people going together, or individually, irrespective of the gender, and getting it checked?
Generally, the causes are 40% could be in a male, 40% in female, and 20% could be somewhere which we gray area we don't know. Out of that 20%, 30 or maybe 25% may be purely male. He could have very low sperm count or difficulty in planning the whole thing. Or in women, both the fallopian tubes are blocked, or she's having polycystic ovary, she's not ovulating, she's little on the overweight side. Or another 15-20% where both have a problem. So she is having polycystic ovary and the man is having low sperm count, and they do not interact regularly with each other. So these are the factors. So first thing what we do is a man's test. Because if you find a difficulty in man, rather than subjecting the woman for unnecessary testing, do a standardized semen analysis for a man from a standardized laboratory. That is also very important. Because sometimes if the report is wrong, you are considering the man is free. Man will think, I'm okay. Till the time again it is done. And till the time you're investigating the woman unnecessarily. So, and it also happens now that if I say that the man's sperm count is okay, the owner's state comes to the woman. She feels I am responsible for this not giving childbearing, and she gets sunken little more because she is actually multitasking, looking after the house, looking after the gas, looking after the bai who's not come, the khana, and the office and the husband. So I think society should change now a little bit the way we look at the woman's situation in this scenario.
Have you had any cases of your own where there are couple who came in and one of them said that, you know what, I'm okay, you got to test first?
No, they never say it openly, but it is understood that the woman will say that, my husband's reports are normal, then it's likely to be me only who's going to be responsible. But they don't know that the advanced semen analysis test sometimes can detect 10% of the men, even though count is normal, their fertilizing capacity can be on the lower side. And they also could be responsible for abortions.
You also mentioned about so many clinics being there, right? So many nowadays, there are so many IVF centers all across, right? Fertility centers. As an individual, do I just go on ratings, or what are the red flags or green flags to go to a particular clinic saying maybe this is the right doctor, because it's fairly a new place even for us, right?
Uh, it's a demand and supply. So if you look at the infertility or inability to have child was about roughly 10%. And men's count in last 50 years has fallen down to 50% of what it was. If you look at parallelly, the consumption of plastic has gone up. In the same time, mobiles have come. The radiation is there. Industrialization is happening. Air pollution is happening. You're cementing work is happening, the food is getting adulterated. So all these will affecting their fertility. That is for 100%.
Right, but which IVF center will I go to?
No, see, if you can go to a gynecologist also, but that is very difficult for me to tell you that, okay, you travel from one end of the town to go to the other end of the town to see that doctor. While traveling, you will take 2 hours, coming back to take 2 hours. It's not going to happen. Previously, it was very easy, people would go on the word of mouth. Now you have Instagram, you have ratings and everything. So you will depend on that. Very easy.
Okay, so tell me, when everyone talks about IVF, right? It is a very overwhelming process. What does it mean? Explain it to me, who has no understanding, but everyone's talking about this thing. Tell me what it is. What does it mean?
See, naturally, what happens in the fallopian tube, the egg is released on the 14th or 16th day, goes to the fallopian tube, waits there. The sperm would come from the track, fertilize the egg, and this egg will move back to the uterus for implantation. This happens naturally. For some reason, if this is not happening correctly, so what we do in IVF, we first select the patient who has no abnormality or very less chances of failure first. Say if she has a 7-8 centimeter fibroid, or her ovarian reserve is very less, so likelihood she's not going to be successful. Or inside the uterus there is a swelling called polyp, so it's not going to allow her for implantation, so that will need correction first. Or she's extremely obese, like her BMI is more than 30, so that will also come in the picture. So first correction, then you will come to the first stage where you give injections to grow not one egg but multiple eggs in the ovaries. Okay, preferably multiple. Then when the egg become a particular size, say about 18 to 20 millimeter, egg maturity injection is given. Once that injection is given in 36 hours under short general anesthesia from lower part, without any cut on the abdomen, we pass a needle inside under ultrasound guided and we aspirate all the eggs. And these fluids are going to the laboratory, and in the lab, they hunt for the egg. This egg is now separated and kept in the incubator, which is meant like a human body at 37 degrees centigrade with particular concentration of carbon dioxide. Then the men's roll come inside. We collect the men's semen sample, we isolate the best quality sperms, and then we inject one egg with one sperm. And that's where the fertilization process is finished. So what happens in the fallopian tube is done. Now, like human body, we have to maintain it in the incubator for 5 days. It can be 3 days or it can be 5 days. 5 days gives higher pregnancy rate. So 5 day, you look at how many embryos have reached 5 days, and then depending upon you want to transfer the embryo back to the uterus after giving certain medication, you can do that. Or the newer trend is don't transfer then, freeze all the embryos and transfer in the next cycle. So in the next cycle, after you get your cycle, you take certain medicines to grow the lining of the uterus, which is called as endometrium. When it is above certain level, say about 7, 8, 9, 10 millimeter, you decide a day of the embryo transfer and then start the progesterone. And then on that particular day in the morning, the embryo is thawed. So what is frozen is thawed again, and then that is put inside the uterus. And the treatment continues for 14 days. After 14 days, you do a blood test called beta HCG, which can tell you whether it's you are pregnant or you're not pregnant. The commonest myth in this is after doing embryo transfer, one should not travel by rickshaw. One should not travel, take complete bed rest. One should not eat garam food, the hot food. or one should not have intercourse, or there are many more to add to this. So every time you do an embryo transfer, you have to talk to them and relax them, because again, as I said, it is in the woman and she's taking the medication. She is going to give you the result. So she is at the stake. So they ask me, should I take a complete bed rest? Should I not go to the job? Or my job where I go is requires 1 hour of trail traveling and coming back. Will it affect the outcome? What we tell them, you do nothing. Actually, what they found, people who take bed rest have a lesser pregnancies as compared to those who go on job. Just imagine you are lying on the bed, looking at the screen or ceiling and thinking, will it happen? Will it not happen? Will it happen? Will it not happen? Will it happen? Not happen. What is happening here? What is happening there? So the mind is always engulfed into the result oriented thing. It's not relaxed. And ultimately, this will have an impact.
Are there any age, like specific age of the couple who's coming to you has much higher success versus someone who takes multiple tries?
Uh, let's talk about the age. Age is the primary most important determinant of the success. As I told you, 32 for women. When I'm saying 32, it's a mean. Somebody can above 35 also can have natural conception, or below as low as 27 can have low ovarian reserve. So age of the woman is very important because she is carrying these eggs from her childhood when she was in her mother's womb. So her age, biological age, is equivalent to age of the ovary egg. Whereas a man is producing sperm every 70 days. So his sperms can be genetically altered by adjusting some lifestyle, some medication. But for the egg, the mitochondria in the egg itself becomes aged. So when you go and see at the age of 42, if you take out 10 eggs, 9 eggs will be abnormal, only 1 egg will be normal. That is in Caucasian population who is kind of 5 years ahead of us. So what we should expect in India? India, the data will come after 2-3 years for us. But in last 4-5 years, we come to know that 32 should be the cutoff for a woman.
So let's say both, right? Both male and female in this situation have are probably at the age of early 40s. Let's take that as an example. They're early 40s and they come to you. Now what you realize is one of them is not either the semen or the egg isn't isn't of the quality that you'd want for it to have healthy children or a child. Is there a alternative where one can actually get a donor, or are there options like that?
Before that, I would like to just clarify. At the age of 40, even though you tell them that your egg number is very less and it can produce a genetically abnormal child, they insist that they want to try at least one cycle with their own eggs. So this is one thing we should know, that they should be told very clearly the chances are going to be very less. Now with advent of genetic testing, now which I told you, the day 5 embryo which is formed, we can take actually biopsy of the embryo and send it for examination, which is called as pre-implantation genetic diagnosis. In that, you will come to know whether the embryo is genetically normal or genetically abnormal. So, say somebody at the age of 41 has 5 embryos and she may have all 5 abnormal or may have only one normal or two normal. So, those which are normal can be transferred and the rest of them will not be transferred. So that has to be understood, which will add extra financial burden that a couple should know. Now, if the patient has already tried this and has not been successful, or the sperm count is zero, or the female egg count is zero, or she has used her eggs multiple times with low number, quality not been good, embryo quality not been good, they can always think about taking what is known as the eggs from a ART bank, that is called as Assisted Reproductive Technology Bank. The government of India has laid down in 2021 the guideline how to handle a ART guideline, whereby they are supposed to procure the egg donor and the sperm donor for the doctors. So they procure the egg donor by doing a certain test and looking at the number of eggs. So the age at which we take them, the government has decided from 23 to 33, but generally we take somebody below 30. So 23 to 30 can go in for egg donation, and men can be 23 to up to 55, but we for our best this thing we take it till 40 only, because after 40 you could have certain metabolic problems like blood pressure, diabetes, and other issues. So rather than that, let's not take it. And these are stored, and when a patient requires specific requirement, if it matches with what we have, then we give them the sperm sample, or that donor is then stimulated and her eggs are extracted and they can use it. The pregnancy rate difference with the donor egg itself can go up to 60% in 3 embryo transfer. That's huge for the age of 41. With her own eggs, it could be as less as zero point 0.2 or less than 2%. And that too with the increased risk of abortion. So that has to be kept in the mind before getting emotionally deciding that no, please try and doctor, please try and do one cycle for me.
Out of curiosity, let's say my partner and myself, right, decides to take the ART route. Um, can I select the kind of persona that I'm taking, the donor's persona?
So
Yeah.
what I do is they find it very difficult. So what I tell them, the first you decide what you don't want.
Mm.
So what you don't want, you decide, then you get what you want.
Oh, so there are options where, like,
Yeah, 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 yeah. You
Okay.
can get certain option up to certain level, not beyond a particular level. Because thing is, it is not, the level of awareness is so low in the society to get the egg donors and sperm donors itself is very difficult task. It's a very difficult task. Now, if I ask any lawyer or any doctor, have you donated your sperm anytime? They look at you like, are you a lunatic? Or if you ask reverse, have you donated blood? They'll say, no, nobody needed, so I have not donated. So you know what is the blood donation percentage in India? 0.03% of the entire population. 0.03%, that too for their own relatives, for emergency, or highly motivated people who go to the blood bank camps and donate the blood. So if the blood donation is at such a low level, semen donation and egg donation, you see how much low percentage it.
I honestly did not know that there are these egg donations that happens, and I'm not too sure like what kind of, because one, that movies have spoiled us, and spoiled us not in a good way, right? It, we've glorified in some cases, and it is a cliche, right? If let's say your parents come to know, or if the society someone comes to know, there's so much of pressure in general for people. You would imagine some of your friends who do that regularly. Now you as a doctor will consider it normal, but imagine someone like me and my friends do it. The chances of them taking each other's case is much higher than doing it for the larger purpose, right? So one of the things that, just going back to the,
Generally, what I tell the couple, that whatever treatment you take, you do not discuss with your parents or with the family at all. What is the need? There is no need. Why do you need to tell them? Maybe your parents, huh? You too should know it. That should be okay for the society.
right, but isn't the IVF procedure as a whole is quite overwhelming, both financially and physically, and for women also emotionally, right? And having that support system
Yeah,
to come together.
support
Yeah.
system, I understand. But ultimately, what treatment are you taking need not be disclosed. It's up to the couple what should be told and what should not be told.
Do you see, when you deal with your patients, do you see a lot of Indian families usually get involved in the decision making process?
Uh, Not very. Currently, the uh, generally the only couples will come. And as an IVF consultant, I also, when I meet the whole family, I request the parents to wait outside when I'm discussing the plan with the couple, because the couples have to give me consent to discuss with them. I'm not supposed to discuss. My client is the couple. My client is the couple. His parents are not my client. So I'm not supposed to tell him anything. I will never say anything to them. Or neither they can tell me ki do this, do that. No, this is not the way. The whatever the couple desires, let's do it that way.
Interesting. So, um, on the there are so many terms, right? I never knew those until I went through one. But there are various factors why a pregnancy can be affected. But you see a lot of young people, like young women, are going through PCOS, PCOD, endometriosis. What does it mean? Why does it happen? Do you think it's because of the lifestyle, or does it affect pregnancy or you being fertile in the longer run?
To an extent, as far as PCOD or endometriosis, or to an extent, low ovarian reserve is also concerned, or for that matter, male also. Lot of things are dependent on the environment,
Hmm.
the stress the person is undergoing, the lifestyle related changes, and epigenetic changes. So these are called as epigenetic changes. So there are generation will come with only 28 tooth. The 4 molar tooth, the last 4 molar tooth will not be there, because consistently the jaw is becoming smaller and they are being removed by the dentist. So these are called as epigenetic changes. So similarly, there are changes happening in the genetics of the gametes, and these are predisposing the future generation for certain diseases. Now, if a lady is born with polycystic ovary, okay, so there are multiple eggs. Now, if she's very thin and lean, a certain percentage, she will have a little irregularity in the period, and after giving certain medications, she can ovulate. That should not be a problem for her. If a problem is the date not coming on time, with the parents are worried about, one medication can be taken for 5 days in a month and she would get a cycle regularly. But if somebody comes with a BMI of 30, that will promote polycystic ovarian syndrome or metabolic syndrome, which could be very dangerous for that woman to become pregnant, because that will push her into, during pregnancy, increased risk of abortions, increased risk of diabetes during pregnancy, blood pressure during pregnancies, twin pregnancy during pregnancies, and all these will affect the maternal outcome. The maternal outcome, in the sense, unnecessary cesarean sections. Her weight can be a problem. She will land up with infection, or the child can be have to be born little earlier, because the mother's condition is not so good because of the weight and other things. So these all things need to be taken care of. But typically, if you tell a couple or a man, you stop smoking or stop drinking or reduce your weight, first thing they do is they change the doctor. They ask question, we have come here to have a baby, and this stupid doctor is telling me to first lose 10% of weight. There are other people more obese than me become pregnant. I say, understand. I understand, completely understand. On the pack of cigarette is written the risk of cancer is there. Whether you smoke or you don't smoke, you will have the risk. Then why it is posted there? It's very clearly written there, no, that you will have a cancer, or you may have a cancer, or increased risk of cancer. So the obesity per se will push you into some complication sometime. If you want to take a chance, you take a chance. And that's how, with IVF centers, if you see, the other chain of centers is NICU. Neonatal intensive care units are increasing because we are delivering high risk pregnancy patients. So nobody is looking at that aspect. So IVF is one financial aspect. The second is the NICU aspect. And then baby going in an ICU at 30 weeks or 32 weeks, developing some kind of complication later date. All this is becoming one after the other, one after the other. You need to find a proper solution for getting this sorted out.
So, someone who has figured out, a woman who has figured out that they have PCOS or PCOD or endometriosis, being single, okay, without the partner or not married, what's an ideal age for them to actually go ahead and do the fertility test?
I think endometriosis will be very symptomatic. She will get pain or everything. So she will go to the doctor. She will get diagnosed with this and can maybe treated with surgically. The most important thing is she should be taking medical therapy to prevent recurrence of the disease. Majority of them, they don't take continuous medication to prevent recurrence. So there are continuous medication can be given in her life to prevent recurrence of
So,
endometriosis.
just on that, right? These are hormonal medicines.
Some hormonal, some are non-hormonal, but these are found to be very safe for person. If they don't suit you, you have cafeteria approach. You have multiple choices. If this doesn't fit, this will fit. This doesn't fit, this doesn't fit. If you have decided that I don't want to take a hormone, then nothing will suit you.
Right. No, but then the hormonal part, like there are two cases, right? Either it is still very early stage of having a cyst and it can be cured or it can be prevented with those medicines, hormonal medicines, which are the similar medicines what ones usually take to not get pregnant, right? Now these also have their own side effects: hair loss, very always very angry, nausea, and look at the current lifestyle, right? And then if you suggest that this has to be continued for a longer period, that also means that it would affect at some point in time their pregnancy as well, right? Because you've kept your body into that continuous cycle of changes in hormones. So how does that work?
As I told you about woman empowerment, and if you look at the history, when did the woman become independent? When the oral contraceptive pill came in her hand. The pill she takes and she decides when to have a baby and when not to have a baby. Have you understood what I'm saying?
You mean the control of, yeah.
Yeah, ovulation. Now, in European countries, people are absolutely fond of taking oral contraceptive pills. They are great. They are fantastic. Okay. And people take it for 10, 12 years. And they are nice, thin, and lean. It's a kind of a myth that oral contraceptive pills can be harmful to your body. Generally, they are no. In treatment of polycystic ovary or endometriosis, even if you take it for 6 months or 2 years or 3 years, this will control the hormonal balance for you and suppress the ovary. And when you want to have a baby, you stop the pills, let 2 months of washout happen, and your ovulation will resume back. Or your endometriosis will, maybe it start coming because you are allowing the menses to come. So it's a bad myth that the people feel. The mothers especially, when we give OC pills to the daughters for irregular period, they feel very, very worried. Why are you giving this, doctor? Please don't give hormones. But you are taking hormones in the milk anyway. The cow is being injected with estrogen, or the chicken is being injected, and you are eating it, isn't it?
Yeah, but I think There is a lifestyle difference. In Europe, I would love to come out of office from at 5 o'clock and go for a run and have a great life. But in India, the way we lead our lives is not the healthiest form in general, right? Now, just talking about the ovulation part of it, a lot of people believe that the best time to get pregnant is during ovulation. Is that true?
Yeah, it's correct. It's correct. But the way it is done is not correct. I will tell you a small story, very interesting story to our great grandparents. Okay. They had no clue about what is ovulation. Okay. After 7 o'clock, when there was nothing, no lights, correct? Children would go to sleep and then everything would happen on a regular interval, right? So they would become pregnant logically roughly 12 times, 3, 4 abortions, 8 kids born, okay? Out of which maybe 4 or 3 die during the some kind of viral infection or plague or anything like that. So 4 which were your uncle, correct? How did they did it, and why are we not been able to do it? For one baby also we have not been able to do it. Why? They did not know anything about it. So ignorance was bliss. They started everything early. Now, intellectually, when we came to know, now IVF is there. We can have a baby later date. Some superstar has a baby at 41. Some superstar has a baby at 31. They had twin pregnancy, they had surrogacy, and then they postpone it without checking themselves and without checking with them, the superstars, what kind of treatment they have undergone. Is something, it's a very misunderstanding. This is what I want to say in the story.
Right. But the cost of living, of having 8 children versus right now, is way, way different, right? Someone who could afford a house and live a certain lifestyle, our parents,
So
grandparents.
I am selecting. You
Yeah.
have giving the word certain lifestyle. So what I'm saying is mall lifestyle, having 2 cars a lifestyle, traveling by air-conditioned train is a lifestyle, or every weekend having a dinner outside, no preparation of food in the house is a lifestyle. Buying a branded clothes is a lifestyle. But majority of India in the rural population and above that top 20%, rest of them are still living the way it is to be lived. I understand the cost of living has gone high, but so do people's are incomes have gone high. It's not that, see, when it comes to paying a doctor, they think about ask for discount. But when you go to their shop and buy eat for 10 days in a row, same 10 days in a row, same masala dosa you eat, 11th day you ask for discount, do you think they give discount? No, it's a logical thing, they don't. But doctors, they ask discount immediately. Please, doctor, give us some discount.
Someone like me, I think I will ask discount even in a small shop. So that I think,
But
but
they know that it's written fixed rate.
it doesn't matter. You have mouth, you can ask. That's the beauty, right? Uh, that's the beauty of it. So, do you think today, when you're saying that people now have an option, right? Even to get from fatter to thinner, everything has an option, right? Everything is injectable, everything has an option. But do you think it comes with luxury? Because it has a lot of financial and emotional stress.
Financial, I explained you. It will depend upon the center you go, the doctor you select, and type of injections you select, and what kind of treatment you are undertaking. Say somebody who, as I told you, requires a PGT to diagnose genetic abnormality in the egg will require higher cost. Okay, or somebody requires sperm sorter to identify a best quality sperm for him, a higher cost is required. You see this in a lot of movies. Say as soon as the marriage happens and 1 year is over, indirectly people start asking, when are you going to give the good news? Now, I think this can be looked into two ways. A, at least in India, there are people who can at least ask you, whereas in European country, nobody is there to ask you. Correct? None of their business, right? At least here, four people, the two parents on each side, be waiting for the grandchildren to come. And from their angle, it is correct. She had her child, means you, when she was 22, and you are already now 32, and you still not have. So you have already delayed by 10 years. Correct? This is putting my thoughts. So at least we have somebody to hold on to talk to, some friends to talk to. Otherwise, the husband and wife sometimes can have a difference of opinion about the treatment, about how they looked after, how the family is looking after. Maybe the boy will go home and tell the parents that, no, I don't have much a problem, but I think her fallopian tubes can be blocked. And the whole focus will be on the wife now. Why your fallopian tubes are blocked, why you have polycystic ovary, why you have endometriosis, and so on and so forth. So I think needs to be identified. Boy and girl are both now are equal. I feel the girls are much, much higher in understanding as compared to the boys, I feel. Really, I feel. They can really handle the stress better than anybody else. Going through these cycles, I have seen it. On top of it, when you tell a couple to go to a psychological counseling, trust me, they don't want to. See, I told you, they're very focused. They want the problem to be solved that they have child. They will have lot of stress inside, but they will hardly talk to psychologists. So in our center, we have given this treatment free of cost. So no tags attached. Here is a psychologist. You have to go and attend. That is compulsory. Follow up, it's up to you whether you want to do it or no. And that is what the ART guideline of 2021 also says. A psychologist is a must in every center.
Right? Okay. So from a emotional side of it, right? It's a huge take, not just on the financial side, because they are obviously spending a lot of their money, their time, energy, but they have also placed a lot of hope, right? How many of these cases, I'm sure the rate of success is not 100%, right? What does a young couple who goes through multiple chances and giving and placing a lot of hope on that, how do you handle that? Do you see that very often?
See, certain percentage of patients, who say roughly 15 to 20% would have what we call as repeated IVF failure. Now, before that, I would like to come and attend to one particular point. Why it is so stressful in India? See, person staying in suburbs has to travel 1.5 hours to go to the job. At the job, he's working for 10 hours and then again 1.5 hours to go back. When he goes back, his mind only wants relaxation. Okay, so what he plans is to eat. That gives him a satisfaction. And second is your Sathi mobile phone. So now he's watching Netflix and wife is watching Prime TV on the same bed, sleeping opposite of each other. And then go to sleep. They don't even want to talk to each other about some here and there. Gas nahi aaya, wo nahi aaya, ye nahi aaya, wo nahi aaya, bas. Maybe on Saturday, Sunday, they will get a chance to talk about it and do something with interpersonal. So this is also where the life is happening around us. So it's something what I say long ago it was said it's a double income, no sex. So people have moved ahead with that. And you ask them, they say, no, 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 we love each other, but this is not possible for us. Well, take it from there. We'll have to explain it to them why it is necessary. One of the important point also, the myth around male is how many times one ejaculate. So the men produce sperms in the testes and they travel through the duct to reach the gland. and then they are thrown out. Okay. Longer they stay in the system, greater is the chance they will get affected by the quality. So, ideally speaking, 4 times a week, they have to take it out. When you tell them 4 times, at least 80% of the men will go back. 4 times, doctor? But I'm not in Mumbai. I am in Gujarat. I am in Kalyan. I'm traveling. You know. So my idea is that you will have to do something to get the better quality sperm, because ultimately you want to produce a better quality child, isn't it? The second myth is, I told you about the obesity, the weight part. That is also a different aspect. Third is, they think that going to a one center, that does not give you result. Okay. Going to the other center, that is called as doctor shopping, and try their luck there. Okay. If it doesn't work there, or he talks the same language as the first doctor, they'll go to the third doctor till the time somebody sells them the higher dream.
Someone who agrees with them, right? But then while again, this is a lot of emotional roller coaster, right? While, let's say, I have all the financial means and everything and I want to have a child, but it's a lot of emotional roller coaster for a woman, and also financially there's a lot of impact for both, right? In that. So if it happens, and there are, and I think you and I also broadly spoke about this offline, was chemical pregnancies, right? Chemical pregnancy is irrespective whether it is natural or IVF, it's very, very common. But losing your first child, that hope that you've placed, how does one deal with it, and when does one try again?
So, one, losing one pregnancy, I think is something which is very, very important for woman's life. There are studies which have found that a woman never forgets those dates. Never in her life. She will always remember that on that particular day I had something terribly happening in my life. And as far as the biochemical pregnancy is concerned, these are generally 90%, more than 90%, are genetically abnormal embryos, which by mistake or because of the extra hormones they get implanted and then they lose, because our body's filtration mechanism does not allow a genetically abnormal embryo to grow. I think now start going to a doctor to take a particular treatment for this, because this once you become pregnant, which the track has been tested, it becomes very easy for the doctor now to give you and guide you better treatment and better hopes for the next time.
Someone who has lost the baby, let's say last week, when does she try again?
The original myth again was to try after 3 months. The best time is to try next month, because
But is it don't you think having emotional capacity to bear a child is also very important?
I understand, but the best chance, your increased chances are on the next month or the next month. Then there's no need of waiting 3 months. The doctors will tell you 3 months, 6 months, 1 year, and do some tests which are not at all recommended by WHO, and people will follow them closely, and then every 3 monthly they'll keep doing tests and show you, see, right now it is how much, this is how. I tell them these are not supposed to be doing it, because these are not responsible for it. But then
You mentioned on this, you having psychologist as well to consult, right? Now, someone have you had cases where a psychologist has recommended not to try right now, and maybe in a few weeks, maybe you come back and consult back and forth and you do that? Do you see these cases?
in India, people shy away from the emotional quotient. They really don't feel the psychologist would really help unless they go in severe form of anxiety and depression, which starts affecting their quality of life. For the rest of the time, they will manage it themselves. The time is a good healer, and they will go along, and they would like to stay away from the treatment as well as possible, because they don't want to see this again. As far as the anxiety and stress and depression is concerned, again, that is very rampant in the females in ART treatment. But nevertheless, one should not forget the men also. Men also will require some support. Okay, then I think here is our society goes missing. The men will be just, they should go out, meet their friends regularly. These couples typically are, the old myth is they're not invited for the baby's naming ceremony, or they don't want to go to the marriages because everybody will keep asking them, when is the news? When is the news? When is the news? And they will be reminded of the same thing again and again, again and again. So I think as a society per se, we should not be asking them anything. Just let it happen. If happens, it will be seen. If it doesn't happen, you don't need to go and talk to them, because they don't want to get help. If they want to, they will ask you. Okay, that is what I may personally feel. Then I feel that doing regular exercise would help them. Uh, Giving time to each other, maybe on weekends. What you do on weekends? Typically, Saturday you get up late, then you go to the mall. You are tired. By the time evening you come home, see a movie, drink coffee, okay, and then go home and sleep. Sunday again go for some party somewhere and come back. On Monday morning you feel again tired. You don't feel fresh at all. If I tell you to sit at home without your mobiles, you will not be able to sit for 1 hour. 1 hour, I'm telling you, 1 hour you will not be able to sit.
But I don't think it is a generation problem. I see my parents doing and constantly being on YouTube.
No,
So
no, I'm not saying
yeah.
generation problem. I am generally saying when the time is required to be spent with each other, when your parents that time did not have these fancy gadgets, so they were spending time with each other. So I think time has to be spent with each other. Emotional need has to be understood, and some kind of guided meditation or something has to be started to get rid of this stress. The stress also is responsible for failure of IVF. Or you become pregnant, and then one stress of becoming pregnant. Now, when you become pregnant, will this go well or no? So that another stress will start. So whole pregnancy you will be under stress till the time the baby is born. When the baby is born, you will have another stress. How will I carry the baby? What will happen to the baby? They have single baby. So it's like I explain like a football. So you have happiness, the ball is with you. You pass your happiness to somebody else and you are again unhappy. So I think one should be happy with whatever you have. It's very difficult. I'm not expecting that everybody should be happy or in this situation. But if you can manage it, it becomes great. Time and again, I'll tell you, some patients undergo IVF, okay, and they have a baby successful, and very less percentage, you can say 5 to 10%, will spontaneously conceive 2 years down the line on their own, which they were trying for 7 years before IVF. Now they conceive on their own. So there has to be some role. See, IVF science is only 40-year-old as compared to your blood pressure, hypertension, all heart problems. They are 200, 300 years. So finding an answer exactly is still going to take time.
Um, as we are closer to concluding this, share us a story that can give us hope that we can have a self-fulfilling life, something that you've experienced, your patient has experienced.
Well, I have many stories, but one of them I distinctly remember. This lady had 2 children in the past, and while traveling or somewhere during she lost both of them. Okay, and by the time she was already kind of age was little higher on the side, and her husband would never come with her. Okay, she was come alone, and she would travel for at least 1 hour to reach me. Okay, and we did the treatment for her, and look at the greatness of God. She got twins, and both were male. So she got her both kids back. Throughout the treatment, throughout the entire treatment, her husband didn't come. Maybe whatever the reason is, he was staying in village and earning there. But this lady never gave up hope. Never gave up. She said, I will have a baby here only. Doctor, you keep trying. And she became pregnant and went home after that. So this is something which I feel that trying was something which this lady had more faith in herself than the technology and the doctor would be necessary, I think.
That is amazing. And that would be very overwhelming, I think, throughout the entire process for her. This is great. That's amazing. That's actually pretty good. How do you see your patients reacting to a failed infertility treatment?
So I think their own expectations, without we telling them, their expectations, when they don't fulfill, they feel miserable. So, for example, if I tell you that the success rate of a intrauterine insemination, where you put the washed semen sample inside the uterus for a woman with oral medication, is only 8 to 10%. And with injections, when you have 2 to 3 eggs, it can go as high as 18 to 20%. When we tell them, they're actually not listening. They feel after the IUI, they go home, take the medicine, and they feel that's it. This is going to give us a pregnancy. What I've told them, 20% is the chance. Means 80% you are not going to conceive. That they don't want to hear. They do not want to hear. They are in denial mode that time. How can this happen, doctor? This is my third cycle of IUI and I've still not become pregnant. Means what? The treatment which we providing you is not suitable for you and you need to step up and go ahead further. So this is what is important, that you should know what treatment you are taking and what are the chances you are expected to have. In European Association, it is very clearly written, per cycle your pregnancy rate can be up to 30 to 40% with take home baby, means you will take the baby home live, can be up to 25 to 30%. It's very boldly written in their websites. No doubt, certain Indian website will also write our chances are 80% and stuff like that. I think that should not be taken into account. Look at the guidelines. And the guidelines will give you correct answer. Say person undergoes a laparoscopy and you come out and tell them that your tubes are not looking good, they're looking bad. You may have to go for IVF. Now, this is what they're not expected. And this is going to push them into a great disappointment. And to get out of that disappointment becomes a big task for them.
No one wants to hear it's their fault, right? Or it's something that is missing in them, right? And it's likely that they move from one doctor to the other and to the other until they find the right answer or until they're succeeding in some cases, right?
So you should also know about why are we getting so less results. I'll give you an example. You have a toothache. You go to the doctor. It's your tooth. Doctor is fixed it. You pay him the money. The pain is gone. You feel great. Here is one genetic material meeting the other genetic material, forming a third genetic material, going to the mother, for which that genetic material is foreign. Isn't it? It's a foreign. The baby can be foreign. And now it's a treatment of two people, not one. Tooth was one. This is two people. And hence, the quality, the constitution, the genetics, the lifestyle, everything is going to affect. And as I told you, it's only 40, 45-year-old science. So it is going to take some time for us to give you a far, far better results.
Thank you so much. It has been an absolute pleasure to have you on the podcast. I truly believe that you've given us the hope to go and not only just look at IVF as a treatment, but look at fertility as a whole, as an individual lifestyle. So I hope people start the journey in positive note with all the positivity that you've given us today.
As early as possible.
As early
As
as possible, and for both the genders.
Yes.
Yes. Yes.
Thank you so much.
Thank you.
Thank you.